Welcome. I am Dr. Thomas Gerber, one of the associate editors of Mayo Clinic Proceedings. In this recording, I will focus on the articles that our editor-in-chief, Dr. William Lanier, has chosen to be featured on the cover of the September 2013 print journal. First, though, let me remind you to please visit the Mayo Clinic Proceedings Facebook page that we started last month. Like us at www.facebook.com/Mayo-Clinic-Proceedings to stay in touch with our latest posts and developments. This month's editor's choice is the original article entitled Immediate Open Repair versus Surveillance in Patients with Small Abdominal Aortic Aneurysm, Survival Differences by Aneurysm Size, which was authored by Dr. Giovanni Filardo from Baylor Healthcare System and Baylor University Medical Center in Dallas, Texas, and colleagues from several other national healthcare institutions. In this study, immediate open repair offered no significant survival benefit, even in patients with the largest abdominal aortic aneurysms and highest risk of rupture. Overall, the findings suggest that the gray area of first-line management for these patients should be resolved in favor of surveillance. The accompanying editorial entitled Abdominal Aortic Aneurysm Size, the Effect of Treatment versus Observation on Outcome, was authored by Dr. Peter Klowitsky from Mayo Clinic in Rochester, Minnesota. The author cautions that surveillance is only as effective as the patients are compliant. Further studies should focus their attention on establishing cost-effective surveillance protocols and on increasing patient compliance with follow-up imaging of small abdominal aortic aneurysms. One of this month's featured highlights is the review article entitled Role of Dietary Salt and Potassium Intake in Cardiovascular Health and Disease, a review of the evidence, which was authored by Crystal Aaron and Dr. Paul Sanders from University of Alabama at Birmingham and the Department of Veterans Affairs Medical Center in Birmingham, Alabama. The author's synthesis of the evidence on the effect of dietary salt and potassium intake on population blood pressure, cardiovascular disease, and mortality supports population-wide sodium intake reduction and recommended increases in dietary potassium intake as outlined by current guidelines, as an essential public health effort to prevent kidney disease, stroke, and cardiovascular disease. Another featured highlight in this month's issue is the original article entitled Software-Guided Insulin Dosing Decreases Glycemic Variability in Hypoglycemia while Controlling Hyperglycemia in Critically Ill Patients, which was authored by Dr. Nicole Soar and colleagues from Tufts Medical Center in Boston, Massachusetts. In this study, surgical ICU patients whose intensive insulin infusions were managed using a software program achieved tighter glycemic control and fewer glycemic derangements than those managed with a paper-based insulin dosing regimen. On a similar topic, the original article entitled Association of Dysglycemia and All-Cause Mortality Across the Spectrum of Coronary Artery Disease was authored by Dr. Shi-Wei Yang from the Beijing Institute for Heart, Lung, and Blood Vessel Disease in Beijing and colleagues from several other Chinese healthcare institutions. The authors found that the association between fasting plasma glucose levels and mortality differed across the spectrum of coronary artery disease. In patients with acute myocardial infarction, there was a U-shaped relationship. In patients with stable coronary artery disease or unstable angina pectoris, fasting plasma glucose levels had no effect on all-cause mortality. The editorial accompanying these two articles entitled Improvement in Our Understanding of Diabetes Mellitus was authored by Dr. Earl Hirsch from the University of Washington in Seattle, Washington. This month's entry into our Diagnosis and Treatment Guidelines article category is entitled Willis Ekbom Disease Foundation Revised Consensus Statement on the Management of Restless Leg Syndrome, and was authored by Dr. Michael Silber from Mayo Clinic in Rochester, Minnesota, and colleagues from several other national and international healthcare institutions. In this article, the authors define the different forms of restless leg syndrome and make recommendations for their non-pharmacological and pharmacological treatment. Two articles in this month's issue address the expanding role of biobanks in contemporary medical care. The original article, entitled Hospitalization and Emergency Department Use in Mayo Clinic Biobank Participants within the Employee and Community Health Medical Home, was authored by Dr. Paul Takahashi and colleagues from Mayo Clinic in Rochester, Minnesota. The original article, entitled The Mayo Clinic Biobank, A Building Block for Individualized Medicine, was authored by Dr. Janet Olson from Mayo Clinic in Rochester, Minnesota, and colleagues from several other national healthcare institutions. The review article, entitled Female Athlete Triad and Its Components Toward Improved Screening and Management, was authored by Dr. Asma Javid and colleagues from Mayo Clinic in Rochester, Minnesota. The authors emphasize that prevention and early recognition of the triad disorders, which include disordered eating, amenorrhea, and osteoporosis, are crucial to ensure timely intervention. Therefore, caregivers and physicians of female athletes must remain vigilant in education, recognition, and treatment of athletes at risk. Also in this issue, our Symposium on Regenerative Medicine continues with an article entitled Wound Healing, A Paradigm for Regeneration, which was authored by Dr. Victor Wong and colleagues from Stanford University in Stanford, California. And you can receive up to 1 hour of CME credit if you complete the appropriate documentation. The concise review article, entitled Pre-Procedural Considerations in Gastrointestinal Endoscopy, authored by Dr. Emmanuel Gorospe and Amy Oxentenko from Mayo Clinic in Rochester, Minnesota, also provides teaching exercises for which you can receive up to 1 hour of CME credit if you complete the appropriate documentation. Video interviews are available with authors of most of the articles mentioned in this recording and some others as well. These interviews can be found on the homepage of Mayo Clinic Proceedings at www.mayoclinicproceedings.org in the lower right-hand corner. Also on the website, our series entitled Meet the Mayo Clinic Proceedings Editorial Board and Staff this month features Dr. Robert Spinner, a neurosurgeon from Mayo Clinic in Rochester, Minnesota, who is a long-standing Mayo Clinic Proceedings editorial board member and who currently serves as a member at large. And just to remind you, you can find on our homepage a number of online-only features that are not available in the print journal, such as extra residence clinics articles, medical images, stamp vignettes, art at Mayo Clinic, and other materials. Dr. William Lanier, Editor-in-Chief of Mayo Clinic Proceedings, the entire editorial board and I sincerely hope that you will enjoy these and the other outstanding articles in the September 2013 issue of our journal. We are sincerely grateful for your interest in and continued loyalty to Mayo Clinic Proceedings. As a preview, the next issue of Mayo Clinic Proceedings, which will go live on our website on October 1st, 2013, will contain articles entitled The Two Medical Worldviews, Why Randomized Controlled Trials Are Needed to Accept New Practices, The Necessity for Clinical Reasoning in the Era of Evidence-Based Medicine, and Association of Coffee Consumption with All-Cause and Cardiovascular Disease Mortality. In the meantime, you can watch videos related to our journal content on YouTube. You can also follow us on Twitter and read our posts on Facebook to stay up to date on online first publications and on breaking news related to our journal. Talk to you soon.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.com. This video content is copyrighted by Mayo Foundation for Medical Education and Research.